in the chat box. Because the original invite has gone far and wide, we don't have everyone on record who is attending. So yes, if you don't want to be missed out, please do put your email ID in our chat box. You can also alternatively send it to Graham, and we'll show his email ID in a second. You can just forward your email to Graham as well. We will also be circulating the slides today to all the AHP leads and the faculty steering group members as well. So they may circulate it out as well. And we hope that we'll have time for Q&A at the end of this. So if you have any burning questions you need to ask, please do put them in the chat box and we will deal with them right at the end of the presentation. So just a bit of housekeeping. So can I have the next slide, please, Graham?
Yep.
Thank you. So just a bit of housekeeping before I proceed. So as you can see, we've got a full house today. So I would request that if you are not presenting, can you please put yourself on mute and keep your camera off? It's only because it helps with the connectivity, not being rude or anything. If you are on Twitter and you are an avid tweeter, please do follow the faculty. You've got the handle there on your screen. Also, a new hashtag has been started by Health Education England, the national team, which is hashtag AHP Practice Learning. And you can follow this hashtag really to understand what's happening nationally as well. So without further ado, I'm going to hand you over to Charlotte, who will take you through the next few slides. So over to you, Charlotte, please.
Thanks, Nisha. Next slide, please, Graham. Okay, so why are we here today? We're going to introduce you to the Cheshire Merseyside AHP faculty and us, the project team. Going to give you some background about why this project is necessary in the current situation with student placement issues, introduce you to the project itself and what we're trying to achieve, and then talk you through the next steps in what we're trying to, where we're going to go with this after this meeting today. Next slide, please, Graham. Back a slide, please, Graham. Thanks. So what is the current situation? So we had an issue with student placement, AHP student placements before COVID, but this was obviously made worse with COVID, with placements being cancelled due to the pandemic. The NHS long-term plan is quite ambitious in that it's estimated that we need an additional 27,000 AHPs within the next 5 years. On top of this, we've got increased students intake onto AHP courses, and this exists due to the introduction of new ways into AHP professions such as the apprenticeship route, but also the development of new AHP courses at higher education institutions that didn't previously offer them. So that's led to a perfect storm for student placements. So because of this, urgent actions needed so that we can help our students to complete their placements and join us in the workforce. Next slide, please, Graham. So a bit of a background about how we've got to this point today. So as some of you already know, in July, HE asked for bids for the clinical placement expansion programme from nursing, midwifery and AHPs. Overall, £15 million was allocated across the country, and that kind of was, that went out in September. For us in the Cheshire and Merseyside AHP faculty, we received that money for our successful bid in October. And that the money for that funding was received by STHK as the host faculty, as the host for the Cheshire and Merseyside faculty. In October, we were recruited as the project team, and then we officially started in our new positions on the 9th of November, so last week. Next slide, please, Graham. So what is the Cheshire and Merseyside AHP faculty? I'm sure a lot of you know by now, but for those that don't, it refers to a collaboration of all sectors across Cheshire, Merseyside and the Wirral where AHP works. So the aim of the faculty is to address common issues across all AHP professions, and we kind of aiming to promote a joined up working approach. So in order to address these issues, we employ a project management and quality improvement methodology to resolve these. Next slide, please, Graham. For the clinical placement expansion programme, this is our project team. So we've got Nisha, who's the faculty lead, myself, Charlotte, who's the project manager for the clinical placement expansion programme, Graham, who's our project support coordinator. Caroline Dunn, who's the chair of the AHP faculty, she's also the head of therapies and psychology services at STHK. And as I said previously, St Helens and Knowsley Teaching Hospitals is the host organisation for the faculty. Next slide, please, Graham. So details of the Cheshire and Merseyside bids that we put in. So we were successful in our bid and we have been granted £200,000 across the 13 organisations that were included in the initial bid. So in terms of how that money is going to be spent, so employment of the project team, so we're all seconded on a 9-month basis, so our employment costs over that period. Investment in the development of the remote training hub and the toolkit, which is the primary project of this project that we're putting in, which Nisha's going to talk to you a bit about later. And then IT hardware, so primarily this is laptops to facilitate the student placements and enable that remote offsite approach to placements. Next slide, please, Graham. Governance of the project, so the project team report into Health Education England, and we do that on a monthly basis. We also report into the Cheshire and Merseyside AHP Council. And for those that don't know, the AHP Council is a collection of AHP leads from across the region. We also report to the Cheshire and Merseyside AHP Faculty Lead, which, as I've said previously, is Caroline Dunn. And then we report to the participating organisations involved in this bid as well. Next slide, please, Graham. Okay, so this is the list of the participating organisations that were initially included in the bid. I know some other organisations have joined since the bid was put in, so don't worry if your organisation isn't on that list at the moment. You'll still have access to the products of what we're aiming to achieve, so the remote training hub and the toolkit. You just wouldn't have access to the hardware in terms of the laptops. Next slide, please, Graham. So these are the 10 AHP groups that we're aiming to increase the number of placements offered to across the Cheshire and Merseyside region. Next slide, please, Graham. And these are the higher education institutes that are included in the bid. Some of these are new, so those of us in the initial bids, there's a few additional HEIs that have been added to this list. Primarily, these include HEIs that are within the Cheshire and Merseyside region, apart from, say, for example, for SALT placements where there isn't an AHP course offered within Cheshire and Merseyside. So MMU, Uni of Manchester and UCLan all had students who come on placement within the Cheshire and Merseyside region for SALT. Next slide, please, Graham. Okay, so now I'm going to hand over to Nisha to talk you through the project itself.
Thanks, Charlotte. I always take a bit of time to unmute myself and put my camera on, so hence the delay. So aim of the CPEP project really is to increase the number of AHP student placements across those 13 organizations by 100 placements, and that is across those 10 AHP professions. The AHP the 13 organizations, as Charlotte said, were the ones who actually volunteered to be part of the bid initially. But as Charlotte has again said, that if your organization is not on that list but wants to be part of the project, they are most welcome to be. Right, next slide, please, Graham. Okay, so this slide is looking really at the breakup of the target. So we have 100 placements that we need to increase, and it's how each organization has been allocated a quota of what they need to achieve in terms of that increase. So for example, on your screen, you've got a few organizations there. So let's start with STHK. So we've put 10 there. Basically, what it means is they need to increase the placements they offer in number by 10 across those professions. Which professions do it, how they do it, as in which numbers increase in which professional group is really up to that organization. However, we will work closely with the AHP leads in each organization to kind of pinpoint which teams will these be where the increase actually takes place. So I'll leave that on your screen just for a few seconds. And then if Graham, you can move on to the next slide, which talks about the rest of the organizations. So it might be that we have missed out some of the professions that are offered by your organization. If we have, please do get in touch with us so we can populate this table correctly. Also, as you can see, the numbers are actually quite conservative. So if you think increasing 10 placements over 8 professions in a particular organization, it's not a high ask really. So we are saying that these are the minimum targets that have been set in the bid. But if your organization is able to offer more placements, it will be only for the betterment of our future workforce. Okay, so if we move on to the next slide, please, Graham. Thank you. So this slide really is when I'm going to talk to you about the how of it, as to what has been proposed in the bid. How are we proposing to achieve this target of 100 increased placements? So there's two main things. The first one is the development of a remote training hub, which will offer asynchronous learning with wraparound learning for students. It will house pre-recorded videos which students can access even if they were not physically present in the placement. And after watching, say, a particular video, the student will have to complete some activities which display how they may have met their learning objectives. These videos we aim will cater to multiple AHP professions and will focus on topics that are different from those covered at university. So this is to avoid duplication. So just to give you an example, a video might be around the patient pathway for a service user who has fallen at home, and then may involve paramedics, occupational therapists, physiotherapists, radiography for diagnostics, and then ODPs if surgery is involved. This is just a very basic example, but that's the kind of multi-professional pathways that we would like to look at in these videos. The same could be done for somebody who may have had a stroke or diagnosed with cancer. It could be around case studies of a child with developmental delay and students spotting the correct referral pathway for that child, or a patient's journey in the community or in an outpatient setting. The videos will also include some general induction videos or those which display some of the soft skills needed in practice. For example, communication skills, dealing with informal complaints, shared decision making, person-centered care, etc. The list really is endless here. The second strategy is of developing a toolkit which aims to move away from the 1:1 supervision model, where one educator has one student in the placement. It's also about employing other members of the team or the MDT to increase placement capacity. So the toolkit will have practical examples of how this can be done in a variety of ways. Primarily, it will contain some sample timetables which show how two students may be managed by the same educator by using the other team members, or the above mentioned pre-recorded videos, or even live virtual sessions with service users. It may also employ the use of shift patterns and weekend working where applicable. It may also contain ideas of how students can be assessed if they are not physically present in the placement, and also what to consider when planning a placement like this. This toolkit will be available to teams who can then take these practical methods and adapt them to their own teams to accommodate more students. The project appreciates that one size won't fit all, and therefore the strategies in the toolkit will provide a framework of ideas which can be adapted to different professions and settings, for example, outpatients, inpatients, and community. The aim really is that these strategies, along with student preparation prior to placement, may lessen the onus on the educator to cater for all of the students' needs. It's also about facilitation of independent learning and for students to understand and acknowledge that there are several other aspects to working life rather than just clinical skills, which will be addressed anyway. So that really is a kind of brief explanation of what the two things are that we will tackle in that project. If you have any further questions, please feel free to put it in the chat box, or you can email myself, Charlotte, or Graham at a later stage. I can see a hand has gone up, Ross. Can I come back to you at the end when we do Q&A, if that's all right? So can I have the next slide, please? So how actually are we going to achieve these two strategies that I've just mentioned? We aim to have two work streams to address this. The first work stream will look at actually designing these MDT multi-professional videos. So the members of this work stream will be involved in actually identifying what topics, scenarios, or case studies will be useful. Also developing that idea and designing a script. Ideas for wraparound learning as well after a student has watched the video. Volunteers will be organized into multi-professional groups to make it more manageable in terms of conducting these meetings, so the groups are not too large. So we have put there, for example, the groups we think may work together to make these videos, but there's no reason why we couldn't pull in different members of the professions into one or the other group. Next slide, please. So work stream 2 will look at the actual toolkit. So we will, in the toolkit, as I've mentioned, it would be around samples of those timetables for managing multiple students, or activities that students can engage in if they were not physically present in that placement. Also utilizing other members of the team. This will be a multi-professional work stream who will work together. Can I have the next slide, please? In terms of a timeline, we hope that work stream 1 can start its work in the new year, and it will be for 8 weeks. Work stream 2 will be, we think, from the 1st of February for 6 weeks. Now, this is the point where I'm going to just explain to you the commitment that we may need from work stream members. We think that the meetings will last about an hour to an hour and a half per week, with some tasks to be completed in between. We would request 75% of attendance in the work stream meetings. And we envision that these work streams will be made up by practice educators, practice education facilitators, placement coordinators from NHS trusts, and obviously support from our higher education institutes. We also ask for your creativity and your gumption to really tackle these issues and come up with out of the the norm, really. Thinking outside the box is what we need here in order to tackle this issue of student placements. So I will come to at the end around the actions needed from today from the people who are attending, really. But this slide just sets out the commitment that we would require from work stream members. Next slide, please. Just to give you an idea of how the project team will also be involved, obviously we will be here till the end of the project, which is August of next year. We will organize the meetings of the work streams and minute taking and the rest of it. We will also support the work stream members with resources and information. We will do all the liaison with finance regarding the procurement of the laptops. Also, we will procure the companies which will actually shoot these professional videos, looking at venues, actors, and the rest of it. Really, our aim is to make it worth the money and get maximum value out of it. We will also be liaising with IT, because once these videos are shot, they need to be uploaded somewhere where students can then have remote access to this hub. We'll also collect some baseline data, which will be both quantitative and qualitative in nature. For this, the qualitative side of it, we'll have to design some sort of a survey for both students and for practice educators who are involved in this exercise. And we will be doing that governance, that reporting every month into Health Education England and to our stakeholders as well. Next slide, please. So this one basically summarizes the timeline that I have just mentioned to you. So November, December time. So this time we will be using for engagement and identification really of our work stream members. Work stream members, we want you to spread the word. We want you to volunteer, because it is really the work is going to be successful only if we have your experience and expertise into this. So we'll be using that time of November and December to set the work up. We'll also be using it to liaise with, as I said, IT, finance and procurement. In January time, we expect our work streams to start their meetings. By March, so by the middle of March, we think that the work streams will complete their work, following which the videos will be shot, there's post-production and uploading to the hub. The time from April to July, if everything goes to plan, the time from April to July is when we will be looking at testing these strategies. So testing that hub, testing that toolkit in practice and seeing whether it actually works and getting some feedback. August 2021 is when this project will formally end with a report. Next slide, please. Thank you. So this slide is really when I want to draw your attention to the tasks. It gives a summary of all the actions that are going to happen between now and the start of the work streams in January. So the first task really is we are asking for volunteers from organizations, especially the 13 NHS organizations who have put their hand up for this bid and are committed to Health Education England. We would need volunteers from across the 10 professions, whoever is employed by that organization, to join either one or both work streams. So members can put their hand up to say they want to join either the video work stream or the toolkit work stream, or if they have the commitment and the time, they can join both. As mentioned before, we need your ideas to make this work. And I just want to say that as a clinician, how often have we experienced when things have been done without involving those who are most affected by changes? So this really is the time to get involved in these changes. We need to know by the 9th of December if you are willing to be a volunteer in one or both work streams. What we need to know from you is obviously who you are, which organization do you belong to, and what is your role, and which work stream do you want to be a part of, one or both. Once names are received, we can send out dates for the actual work stream meetings that happen in January. The second action is that the project team are organizing drop-in sessions to engage with the 13 organizations. I say 13, but any participating organizations who want to be part of this really. So the dates have been organized for groups of AHPs across organization, and we will send the MS Teams link out when we send out these slides to you. These drop-in sessions will provide an opportunity for you to ask questions or express your views with regard to placements. This will happen in the next 2 weeks. Please do attend these drop-in sessions and come and speak with us. We want to hear from yourselves as to what you think may or may not work, and also your views about what difficulties or barriers have you come across when you have taken students on placements in your organizations. The third action is in the week of 14th of the 12th, we will organize speakers who can tell you about the different approaches that they have used to increase their placement capacity. We are also hoping that our universities will be able to do a couple of presentations for us to just give you more information on the impact that a shortage of placements has on our workforce and our students. Please do look out for this invite. We will call it the CPEP Information Sharing Event. This will be useful for anyone to attend, especially if you're considering joining the work streams. We hope that listening to these speakers who've tried different things will give you some ideas, but also inspire you to think outside the box. Can I have the next slide, please? Thank you. So number 4, action-wise, is the project team is going to liaise with the AHP leads of the 13 organizations to agree on the increase of student placements by profession and how this information will actually be cascaded to those teams who will take more students on. So the point to consider here is that normally universities will ask for placements for the new academic year to be confirmed in the March, April time of that year. So for example, for September 2021 intake, universities will be getting in touch with organizations in March, April time. So really that September intake, we need to commit that we will be taking 100 more students between these 13 organizations. Therefore, the project team will liaise with your AHP leads before that March time, really, to confirm those teams and numbers. We'll also be speaking to finance and procurement about the procurement of these laptops and the best way to go ahead with this. And the last task really is to identify the test teams. So this is something for the work stream members. Once the strategies have been put in place, we want some teams to come forward to say, yes, we would like to try and test these techniques out to see if they work, how well they work, and what tweaks need to be made as well. I'm conscious I've given you a lot of information there, but these slides will be circulated. And as I said, I'm hoping that we'll have a bit of time for discussion and Q&A right at the end. Okay, I think that's about that slide. Can I have the next slide, please? Graham, can I have the next slide, please? Yeah.
Sorry.
No worries, don't worry. Okay, so really the question you might be asking is, what's in it for you? And you know, we are not appealing to your altruism here purely. We are asking you to be involved for really safeguarding your own professions and workforce. If our students don't complete their studies and courses on time, there may be a delay in them joining the workforce. So really, it'll be us existing clinicians who will end up feeling more pressure due to vacancies and gaps in services. And therefore, we are requesting that, you know, we get involved in this work. I can say from personal experience, so for those who don't know, I'm an occupational therapist by background, and I lived in the clinical world before I came to the world of this faculty. And I can say from personal experience that being involved in faculty projects is great for collaborative working and networking across the region. You not only raise your own profile, but there's so much learning to happen when we work together. We, at the end of the toolkit, we will be putting a list of contributors, and it's a great opportunity to get your name in there and on the finished products if you were part of the work streams as well. It'll obviously add to your CPD and support any HCPC registration. Also, as Charlotte mentioned before, we employ a project management and QI approach, and it really enhances skills of leadership and QI. So if you are somebody who's looking to do something slightly different or looking at a next step in your career, this is a great platform to do that as well. And I've put that right at the end about COVID. You know, you may or may not have heard, but there is apparently a pandemic out there. So the project really gives you a chance to participate in something which is not just about COVID. And sometimes a change is what we may need to refresh ourselves. Excuse me. I just want to assure you as well that the project team will support the work streams in every way. You will not be left to your own devices to do this work. It will be a collaborative project, really. So I just want to say that we hope that you feel energized and motivated to come and join us, because we truly believe that we are stronger only when we work together. Can I have the next slide, please, Graham? So lastly, to reiterate, we don't want to miss you out from our circulation list for this presentation. So especially for people who joined us slightly later, if you can put your email ID in our chat box, and we will ensure that the presentation slides get to you. So that really is the end of this presentation. So thank you very much for listening, and we are now open for Q&A. So what I'm going to suggest is, because the number of people we have on the call, if I can ask Graham or Charlotte if they've been keeping their eye on the chat box and if there's any questions there.
There was a question about I think it was CWP. Yeah, so CWP gets SALT students from outside of those universities as well.
Okay. So if you can get in touch with us to let us know who those universities are. We won't be able to cater to all universities as part of the project. It really has to be focused at this stage. But what we are hoping is, once these strategies are put in place, there's no reason why you couldn't take extra students on from any university, really. So I hope that answers part of your question, but do get in touch with us to say who those universities are and whether they use that coordinated approach that speech and language therapy placements do use amongst those 3 universities.
And then I think we also had a question from, I think it was Ross Mitchell, put his hand up first.
Yeah, Ross, do you want to come in now? Ross, are you on the call with us?
Oh, he's just trying to unmute himself. If you want to pop it in the chat, Ross, I'll read it out. Just while we're waiting for Ross, we had a question from Jill Fathian from Salford University.
Yeah, hello, can you hear me?
Yeah.
Okay, I've got a few questions actually. Apologies I came in late, but just the secret information sharing event, sort of when on the timeline is that proposed?
We are thinking the week of the 14th of December, Jill. We've got a few speakers and they can do either the 15th or 16th of December. We are hoping that we will confirm it really this week till next week about who are these speakers, and then we will circulate that information.
Okay, and the other thing is the test teams going forwards with the project. Sort of when are you looking at the test teams in the timeline? If it's finishing sort of August 2021.
Yeah, we are looking at really to get everything ready. It will probably take us till April to get all the videos shot and uploaded onto this hub. So from April to July will be the time when teams who have students on placements can try and test these strategies out. What we're saying is that the test teams don't necessarily need to take on more students, because we are aware that people might have already committed to the number of placements they will take for this year. So even the number of students they have anyway, these strategies can be tested out. There may be an opportunity that if there is a cancelled placement and a request goes out to an organization to take an extra student on, that these strategies could truly be tested in that April to July time.
Yeah, I'm just thinking sort of logistic wise from our point of view, when students are actually out on placement and when they finish. And the different sort of levels of students. So some will have graduated by, our students have graduated by the beginning of June. They've completely finished their placements by May. If you're looking at sort of final year students, second year students, it's completely different. So that's why I was sort of raising that question from a logistics point of view. But it's something I suppose we need to consider going forwards. And then I suppose the old chestnut is how much time commitment really are you looking at from us to put in? Obviously, the more we put in, the more you'll get out of it. But everybody is, well, certainly in our institution, we are absolutely running sort of on empty. So I just wonder what sort of time commitment you're realistically looking at from us. Because I don't want to sort of, if we commit, and I'm sure everybody's in the same sort of situation, in the health service and everywhere, to make a commitment and then not to be able to deliver. If we've got some idea of time, it would be, I think it would be useful.
Yes. I think you may have missed that, Jill's, that slide, Jill, but I'll repeat that information. So for work stream 1, for both work streams, we're looking at an hour to an hour and a half per week in a work stream meeting. With work stream 1, which is around the videos, we think that we will need 8 of those meetings. There might be some commitment to do some reading up, or I don't know, looking at a script, in between those meetings as well. And we will also request that people maintain 75% of their attendance at these work streams. We completely appreciate the pressures that everybody is under. But there is, within the time that we have been provided to actually do this, this was the most that we could spread it out by, if that makes sense. Does that answer your second question, Jill?
Yeah, and is that sort of all volunteer on a volunteer basis, or is there any costing in that within the project for time for input?
It is on a voluntary basis, really, and the volunteers are mainly from those organizations who have definitely been mentioned in the bid, who had put their hand up way back in July to be part of that bid. So that was the commitment to this project, so to speak. Jill, can I just answer your first question as well around the timing and the students completing their placement? So we have highlighted that as almost a consideration and a concern with regards to the timing of the project when we report back to Health Education England, and we will continue to do that as well.
Okay. Because I'll definitely push it higher, but and it's a fabulous project, and I really would like to get involved. The only but is the time commitment and the pressures that we're under, and I think everybody's in the same situation. So I think I just need to push it higher to see if there's support from above, because I would hate to sort of have a half-hearted approach to it. Well, thank you very much.
No problem. Thanks, Jill.
Thanks.
Who do we have next, Graham?
Yeah, so I think Ross has managed to sort his microphone out now.
Yeah,
Thanks.
Ross, do you want to come in?
Can you hear me all right?
Yes, perfect.
So I just wanted to ask, so am I right to think, I just want to make sure I'm understanding this properly. So we've got, as of September, the increase in numbers was the plan was for that to be from September 2021. So we've obviously got some time for those numbers to go up. Is that something that we're anticipating is going to carry on? So those numbers would be higher, continuing to go forward. And if it, it sounds like an amazing opportunity for it to work differently than we have for so long. Is there an idea that those numbers will go up even more as over the coming years?
So yes and yes to both. The methods we are putting in place, the numbers we have said are the basic minimum really, and there is much more scope to do more. So the methods that we're putting in place have to be sustainable. The numbers have to be sustainable, not just for the sake of this one project for 1 year. So you're right, Ross, that we have to keep it going. And yes, if teams can offer to take more students than the basic numbers that we have outlined here, that would be fabulous, because that's what we really need. I guess this project is proving that this concept can work. And then it's up to those organizations with support to run with that and take it even further. Does that answer your question, Ross?
It does, yes. So if I can just ask a quick follow-up, so are the universities going to have an influence on those? They must have an influence on those placement numbers if they're going to have more students going on to courses. So the universities are going to be having an increase in funding for those additional students. And I think historically, I'm not sure where we're at from our own individual trust perspective, but there was some sort of quota about funding for a number of students. Has that kind of conversation come up yet with regard going forward? If we're having, if we're taking more, I appreciate the capacity to see more students working in these different models is higher. So If it involves some additional working where we do need some more staff or staff need more time, from that perspective, has that kind of come up from the universities? I'm just mindful of the number of placements and payments to trusts for university for student placements.
So Ross, are you talking about the placement tariff here?
Yeah. Yeah.
Right. Okay. The placement tariff is obviously always a burning issue. It's not something we are addressing particularly as part of this project at this stage. Okay. However, placement tariffs go with the number of hours of placement completed, really. So if an organization is going to be doing more of that, that will be obviously reflected in the data that is submitted to Health Education England from our organizations. This project is more about how these organizations, the NHS organizations, are going to do things slightly differently. Yeah. HEIs are there obviously to provide their support to us, but the work streams will be really made up of members who are part of the organizations. But you're right, tariff will obviously be affected as you take more students on. How that money is used is a completely different conversation, isn't it?
Yeah, that's it.
Yeah.
That's it. Yeah. We get the staff ask those questions as well. You see, if we're taking more students, are we getting more money to be able to use that money differently? That's you know.
Yeah, I maybe can invite somebody from the universities who are present here to just put a little comment to us. Just unmute yourself and please comment on what Ross has said about whether the organizations would automatically get more tariff money. I think we've got Jill and Rebecca from University of Liverpool as well. So either of you, if you want to just confirm that to Ross.
No, yeah, not necessarily automatically, yeah, but just it would be something that would be looked at in the future, really. That's it.
Yeah, sorry, I'm Abigail from the University of Chester. I'm relatively new as being placement coordinator, but we are trying to do a bit of digging. So basically every student that goes out on placement, we collect the number of hours that they do on that placement and with regards to which trust they go to, and all that information goes to HEE. Basically what HEE does with that, they then send that money to the trust, and it's about what your organisation does with that money. So if you want to know where that money gets spent, you need to put pressure on your trust to tell you, because I suspect it's not always filtering down to the AHPs directly. So yes, all of your hours are collected. We send all that information to the HEE, and from then on, it's up to your organisation where that money gets spent. And we would love it if you question that with your organisation.
Okay, fantastic. Thanks very much.
Thank you. Who we got next, Graham?
So I think next we had Abigail Price, who had her hand up.
Abigail, do you want to come in?
Sorry, I muted myself again. That's me again. Yeah, so I'm from the University of Chester with the dietetic students, and I was just looking at the timeline that you were suggesting of when we might use some of the test cases. Realistically, when do you think we'll see the increase in placements being provided? Because we've got an increase in students already, and they'll be going out on placement March, April, May time of next year, and I need to plan those placements from December. So are we realistically thinking we can cater for the increase in students from in this academic year?
So to answer that, Abigail, the strategies that we have, the project team has been in post. So me, Charlotte and Graham are in post since last week. And that's basically come about because of the timing of how the funds have filtered down from HEE. So to get those strategies ready in place for December, obviously it's not going to be realistic. However, there is no reason for organizations still not to think differently in the meantime and put their hand up to say if they can take some students on that you need placements for. It's just that the strategies in this project are obviously not going to be ready for December. Just because of the way the timing
really
of the
strategies need to be ready. It's the commitment, really. So I mean, it's December when I'll be asking placement providers to take an increase in students. Are we able to say, with the planning that's going to go into place, can you forward think that you might want to take more students in March, April, May?
I would agree with that, Abby. And what we're doing is, as I said in one of the slides, I think in the action slides, the project team will be getting in touch with all of those AHP leads, of especially those 13 organizations who are part of this project, to have that commitment, and how that information then will be actually cascaded down to the placement coordinators and the various teams who do take students on. So you're right that that commitment has to come from those organizations quite soonish. The plan is to do that engagement plan over November and December.
Fab, yeah, and I think it's important that, you know, some of the smaller AHP teams aren't always involved in the sort of higher level coordination within trusts and things like that. So it's just about making sure that that information filters down to the smaller AHP groups.
Yes. And I think we are requesting that people who are today on this call really help to disseminate that word to those smaller teams, because it's not just about the bigger professions. And when I say bigger, I mean in numbers, but it's about the small but mighty professions, the AHPs as well, who need to be part of this. So absolutely, we need your help to actually spread the word about this project.
Yeah, fab. Thanks, Nisha.
Thank you. Thank you. We've got a few hands up, and I can see that there's a few questions in the chat box. Tell you what, it might be just easier if I ask people to put their hand up now, because I've lost track of the chat box. Who have we got next, Graham?
So the next person is Ryan Noeline.
Yeah, Ryan, do you want to come in?
Hiya, it's Nolene. My name goes back to front. It's all right, I think all work.
Do apologise, Nolene.
Hiya, so I am the team lead for the PEF service at Luft. So I just wanted to confirm, someone was asking about will we get paid for the extra students. At the moment, we have just done the return for the first quarter, where the universities upload all the hours and the trust confirm it. So hopefully we should have that money into the trust. I've been told after Christmas, and then the second return is going in December for August to September period, and we should get that money in February, March time. So we're always kind of a quarter behind. HE have just changed how we confirm our numbers, so we do get paid. The money comes into the trust in two sections. It's identified as allied health and nursing, and then which comes under non-medical, and then medical money comes in separately. So if you're looking for the funds, I'd go to the accountant and you're looking for non-medical, allied health and nursing, and the money is broken down per profession.
Okay, Nolene, that is so helpful to actually get that overview for the whole group here. So thank you for that.
No problem. Take care.
Thank you. Who we got next?
Jill, have you got another question, Jill?
Sorry, it's been left up. It's a legacy hand.
All right, sorry. It'll be Sonia Davis then.
Hiya, good morning everyone. I was just wondering if you are including apprenticeships as your capacity increases as well.
So we have just, Sonia put it as 100 placements. Really, we have not yet divided it up into, you know, undergraduate apprenticeship. It's just 100 placements that we want to increase by. So if it was apprenticeship students, I don't see why not. They could be part of this, but leave that with me if I can have a think about that and get back to you if that's okay, Sonia.
Okay, thank you.
And then next we have Karen Mercer.
Hi, Karen.
Hello, hiya, can you hear me?
Yeah.
Perfect.
Oh, good. I've just got a couple of things. Just to say that the data collection tool, it's called the Student Data Collection Tool, and it's important that everybody does get involved with that and returning the student numbers or the student placements that you offer. Because you have to, as Nolan said, you have to agree it with the university. So if you do get in touch with your PEFs, if you don't know about it, then it's the Student Data Collection Tool. My other question, Nisha, is just to ask, have you scoped the placements for all of your 13 trusts that are included, possibly more? just to compare, so what the students' levels would be in one trust against another, of sort of, so we were looking at, you know, like for like, if you've got a team of X amount of physios, what number of students are they taking, just so that you can compare between the trusts. We did a really good exercise a few years ago with Health Education England, and we're still, because of different things, it kind of it wasn't done again for a few years. But what it did do, it gave trusts a bit of an idea of where they were compared with other trusts, and I think that's a really good exercise, especially when you're looking at so many different professions, because you've got bigger teams, smaller teams, you know. So I think that's a good starting point for a scoping exercise, so that you can then, for the beginning of your project, say, well, actually, you've got a massive team, why can't you take more students? And you can delve into that. So that was just one of my sort of points. The other thing I was going to ask you, which I've forgotten about now, but what was something we were talking about earlier? Just looking on the chat. Oh yeah, the students. I'm aware of a couple of professions that have, you know, take quite a lot of students. So for example, ODP and dietetics in our trust, they have increased their student numbers over the last few years quite markedly, and I'm just wondering now, will you take that into consideration, because they might have increased in the last 12 months, but now that with this project, would you want those people who've already increased to increase again for next year? Just one of my concerns, because we might be already at a capacity for that.
Yeah, so Karen, the data collection for this project, so we are in the process of actually designing the data collection tool and what we need to consider. So that's something that we can do with actually speaking with people like yourself who have been involved in that exercise. So if it's okay, can we connect with you separately with regards to that? Also, with regards to your second question, where you mentioned about teams who may have already increased numbers, really, it's not for us to dictate who needs to increase those numbers. It's for the organizations to look in and say, yeah, they've already done what they've needed to do, and maybe it needs to be another team or another profession. So that conversation the project team will be having with the AHP leads to really get to understand who are these teams that will increase those numbers. Does that answer that question?
Yes, yeah, it does. Thank you.
Okay, thanks, Karen.
And I think that's all the questions we have, unless anyone wants to put the hand up.
So we have loads of comments, obviously, I can see in the chat box. Does anybody want to come in on one of them? Only because it might be tricky for us to go through all of them just here live. Otherwise, we will review them after the presentation. Yeah, Sonia, do you want to come in?
I agree with the equitable allocation, and I do think that it would help for plans, but I also consider, obviously, consideration to service pressures and impact depending on what specialist services they might have at that time. It's just so that you can use a tool to say, well, what's that organisation? They have so many X amount, you know, and why are we doing it so differently? And it's a good way of sharing. It's something that is one of the tools as such for supervision to help for that. And I'm just wondering, it's obviously the data protection for trusts. Everybody would need to agree to share that information. So that's the only downside to it. But I'd be quite happy to share our trusts, and if anybody would like to share with us, we would be grateful. Thank you.
Can I just add in a word about the capacity as well? So there is a separate piece of work that is likely to happen for the whole of the Northwest, looking at placement capacity across all organizations. So that obviously is in the pipeline, and it might eventually help with this work that we are doing. This project is all about getting those strategies in place for that rapid expansion here and now, because I think, as someone mentioned, maybe Abigail mentioned, we need people to commit to take those students as of now, soonish, and the rest of it, yes, will help, but really we need your commitment to come into this work kind of straight away to increase that placement expansion.
Oh, I agree with that, Nisha, absolutely. And, you know, you've set some realistic targets as well. So for your minimal targets, because it'll be a year-on-year increase by looking at what they want in the 5-year forward project. So I think people will just take on maybe not overdoing it the first year, because they're going to be expected the following year. But if we get that information along the line, we can see where we've got huge gaps on year.
Thank you. Thank you. So if there is no more burn at this stage, I would just like to go back to Graham, if you can go to the slide which talks about the actions, just to reiterate what we are asking for today. Yeah, that one. Thank you. So if you can go away, disseminate the information. We will aim to get this presentation out to everyone who's given us their email IDs in the chat box. If you can motivate, or yourself, if you want to be part of the work streams, please let us know by the 9th of December. It could be one or both work streams that you could be part of. In the meantime, we will also be doing these drop-in sessions, which will be quite profession specific. We will send you the links for them. Please do come along and talk to us and express any more concerns or views that you may have. And lastly, we will be organizing a CPEP information sharing event for examples that have been successful when multiple students have been taken on placement. Please do come along. Invites will be sent soon. So really with that, I think we can wind up this presentation. We will leave the last slide on, Graham, if that's okay, with our contact details for people who may not have them. Please do get in touch if you have any further questions. Just want to say a massive thank you for a fantastic turnout, and hope to see you soon and work with you. Thank you very much. Bye, everyone.
Thanks, everyone.
Thanks, bye.
Bye-bye, bye-bye. Thank you for coming along. Charlotte and Graham, do you want to just hang on?
Hi all. I made the last 5 minutes.
Oh, hi.
Lisa came in at the end. Apologies, I had 2 things on at the same time, so I just thought I'd cut in as soon as I finished the other one.
Don't worry.
Could you do me a favour? Could you send me through the slides so I can have a little
We've
flick?
recorded it